What's up everybody? Dr. Rossi, shrinksandsneakers.com. So in this video, I want to talk about inflammation. Specifically, I want to answer a question that comes up sometimes, and this is kind of new research in psychiatry. It's a new area that is being explored extensively, at least within the basic scientific research community. And that is, what role does inflammation play in depression? And could it be possible that depression is actually an inflammatory disorder? So I'm going to answer all that and more in this video where we talk about inflammation and depression. So I want to start out by saying, what is inflammation and why is it important to us? So I'm going to define it really simply here. I'm going to define it as the body's natural response to infection or injury. So inflammation is what happens when the body is damaged and there's some kind of infection or injury. Inflammation can be a good thing, and it's actually essential for our survival. So it's an important thing. It's essential for our survival. However, what do we know about chronic inflammation? Well, we know that chronic inflammation is a bad thing. It can be really harmful to our bodies. It's known to contribute to things like heart disease, cancer, and even neurodegenerative diseases. With that said, inflammation is obviously an important thing in our lives for both survival, but too much inflammation or too chronic of inflammation can be a significant issue. So what can we say about inflammation as it relates to depression? We can actually say a few things now because there's been enough evidence to kind of support some of these things. And I'll say that some patients with depression have elevated inflammatory markers. So you might be asking me, Dr. Rossi, what are those inflammatory markers that we're talking about? In cardiology, they use something called C-reactive protein, or CRP, and it's a marker to help predict the risk of cardiovascular disease. Another thing that's known to be associated with inflammation is obesity. So obesity is known to be correlated with inflammation and can result in elevated C-reactive protein, or CRP. Now, we know the standard American diet, if you're following a standard American diet, it contributes to both inflammation and obesity. So if you continue to eat the way many people are eating in the United States, you will eventually develop increased inflammation as well as obesity. So CRP, or C-reactive protein, is now being looked at in psychiatry as a potential marker for inflammation, but it also may be able to help us make a prediction about which medications a patient may or may not be responsive to and what the level of inflammation is in that particular patient's body. I'm going to explain more on that in a second. So let's take a deeper dive at looking at how one might use C-reactive protein to inform their treatment decisions and their decision-making practices. So the current recommendation is quite simple actually, and that is first to determine if the patient has significant inflammation. And how do we do that? Well, we order not just a regular C-reactive protein test, we actually need to do the high sensitivity CRP blood test. And the reason why we have to do high sensitivity is because the cutoffs for depression are a little bit lower than that for other inflammatory disorders. So let's dive into some of the details here. So the exact cutoffs are actually not clear. So we don't know exactly where we should say someone has increased inflammation or doesn't, but I can give some guidelines, and what we find is that patients who have somewhere between 1 milligram per liter and 3 milligrams per liter are reasonable reference ranges to refer to when you're measuring this ultra-sensitive or high sensitivity C-reactive protein. So we look to the literature to guide us. What does the literature tell us? We always want to go to the research, we want to go to the evidence, we want to know what the facts are, right? And there actually are a few randomized controlled trials available. One such trial was published in the American Journal of Psychiatry, and it compared escitalopram, Lexapro, to nortriptyline in 241 patients. So 241 patients, pretty good number of people. And patients with a C-reactive protein of 3 milligrams per liter actually did better than on the nortriptyline than patients with a low CRP of 1 milligram per liter. They did better with escitalopram. So what's interesting there is that we know that escitalopram is the most selective for the serotonin transporter. We know that it's primarily a serotonin drug, that there's really no other other mechanism at work there. Where with nortriptyline, we know that that's a TCA, and that's going to have a significant neuroadrenergic or norepinephrine effect, as well as serotonin effects. So it seems like, at least from this one study, that patients who have higher inflammation react better to drugs that have both serotonin and norepinephrine activity versus ones that have strictly serotonin reactivity. And it seems like the people with lower inflammation do better with just a pure serotonin-based drug. So, what do other trials say? So we have another trial we can look at where they use bupropion or Wellbutrin as augmentation for 106 patients, so again, pretty decent number, with major depression, currently taking escitalopram. So here we go again with that bupropion escitalopram combo. But they looked at these people, they augmented them with bupropion, and what they found here was bupropion improved depression, again for people whose CRP was greater than 1 milligram per liter. So a similar result. If you get this C-reactive protein test and you find that it's elevated, it seems like people respond better to drugs with norepinephrine, dopamine, and as opposed to those with just pure serotonin. So a common factor in both nortriptyline and bupropion is that they both have an effect on dopamine. So clearly dopamine is playing some role here in this process, and it has something to do, again, with those who have higher inflammatory rates. The precise reason for the increased dopamine level seems to improve depression in patients with inflammation is not clear. We don't know. We don't know exactly why dopamine seems to be more effective in patients who have higher inflammation, but there seems to be at least some evidence from the literature to support this. However, we still need more research to kind of inform our decision making, but at least this is kind of giving us some insights that, first of all, inflammation plays a role in depression, and second of all, that it seems to respond better to dopamine-based drugs rather than your traditional serotonin-based drugs. So a couple of key points here about pharmacotherapy for patients with depression and inflammation. We can let the evidence again guide us a little bit here and tell us when we might choose one medication over another to treat somebody with depression and inflammation. Nortriptyline. If a patient has a CRP greater than 3, there is evidence to support the use of something like nortriptyline, again, with that dopamine, norepinephrine, not just serotonin-based drug, over an SSRI, specifically escitalopram, and that comes from the one trial that I described previously. Bupropion for patients with a CRP over 1, or those with obesity, or those who are needing augmentation because they're not getting full remission with, say, something like escitalopram, they may benefit from bupropion. So we want to think about Wellbutrin, bupropion for patients with a CRP over 1, those who are obese, and those who have not responded adequately to another serotonin-based drug. Lurasidone is interesting here. Now, lurasidone is commonly used to treat bipolar depression. It does have some evidence to support its use when patients have a CRP, C-reactive protein, greater than 2. So again, we can kind of use the trials, the data, to guide our decision making here. And I actually really like lurasidone in bipolar depression. Unfortunately, it's only a brand name drug at this point, and it costs a significant amount of money, so that can be a barrier when you do community mental health treatment like I do. The fourth option I'll point out here is pramipexole. So pramipexole is another dopamine agonist drug that I've talked about in the past, and we said that dopamine seems to be the neurotransmitter of choice when inflammation is present. This does have some evidence to support its use in animal models and off-label in use of treatment-resistant depression. So we do have that treatment-resistant depression evidence, and we also have some animal model evidence that indicates this may be a decent option. Okay, so to wrap the video, the end is here. What can we say ultimately? So I'm going to say I don't believe that all of these new insights into inflammation and depression are ready to be considered the standard of care in psychiatry. So we got to be careful when we're talking about these things. It's interesting, it's exciting. I want to bring the information to you guys, but I don't want people to get into this idea that everybody should have a C-reactive protein ordered. Everybody should be switched to dopamine-based drugs if their CRP is elevated. You know, we have to kind of understand this is in the beginning stages of being researched appropriately, and obviously, for patients who are struggling with obesity and treatment resistance, or who have had a poor response to initial antidepressant treatment, they may benefit from ordering a CRP level, right? The high sensitivity CRP, and then letting that help guide decision making based on medication choices. So we may want to consider for patients, again, who are at risk for high levels of inflammation in situations such as obesity, as well as people who have not responded well to treatment, to the standard treatments offered. Like most things in science and most things in medicine, more research is required. But inflammation, it remains an interesting target for depression treatment, and I think a lot more on this topic is going to come in the near future. So with that said, I'm going to hold it there. If you guys got questions or comments, drop them below. I'm happy to talk more about inflammation and depression. It's a passion of mine. It's an area I'm really excited about. And please like and subscribe to the channel. It helps me to keep going and keep creating more content.